Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome back Dr. Catherine Smoot, an ophthalmologist from Chesapeake Eye Center, to the program as we are going to discuss a very new and exciting procedure for removing cataracts. It's called refractive laser-assisted cataract surgery. Correct. Or RELAX for short. We have to have an acronym. And it sounds just terrific, and it's been a few years since you were on the program and showing us the previous technique. So before we get into the surgery itself, and we're actually going to go into the operative suite at your practice to actually see a live procedure, first let's talk about cataracts, what they are, how they come about, and then we'll get into the correction of those.
Okay, well thank you, Mary, and thank you for having me back. Basically, when we're born, the lens of our eye, which sits back here, is clear. Just like your windshield, light goes through your cornea, through this lens, and focuses on the retina, which is like film of a camera. As our body ages, 100% of people will develop some form of a cataract because this lens ages. And instead of becoming clear, it gradually becomes more yellowish, and then on down the road can become more brownish, or get other changes that would inhibit the ability of light, and stop light from getting to the back of the retina, and your vision starts to decrease. The signs or symptoms of cataracts can be varied. You may see changes in color, decreased vision, glare, headlights, and night driving may become an issue, or you may have trouble reading. Any of these things are your activities of daily living. And when those activities of daily living are affected by your vision, then it's time to talk to your surgeon about whether you should be considering cataract surgery.
And what age does this typically happen?
You know, it can happen at any age. There are children who can be born with cataracts, but most typically, aging cataracts can happen anywhere between your 60s and your 70s, 80s, and on up. The older you are, the more likely the cataract is to be more advanced.
Are there any risk factors that would accelerate this process?
Well, of course, the Waterman study was done on the Eastern Shore, and exposure to ultraviolet. We're looking at certain medications, such as prednisone, can lead to certain cataracts.
People that are outdoors all day in the sun, not wearing eye protection, skin protection, it's all good, right? Okay, so it's definitely a disease or a condition that occurs a little bit later in life for most people.
Correct.
And hopefully people are getting annual eye exams. We can hope for that.
Correct.
At what age should someone start seeing an ophthalmologist on a more regular basis to keep an eye on such things?
Well, it depends on your family history. If you have a family history, glaucoma may be different than or macular degeneration, different than somebody who doesn't. Certainly, as we get older, if you start noticing changes in your vision, you'd be talking to your eye care provider about what their recommendations are. But as we get into our 60s or 70s, once a year is probably a realistic time frame in order to monitor your natural lens changes and cataracts.
Of course, we know we all pretty much need reading glasses as we age. 40. But there's good news about the surgery because you can insert a prescriptive lens, a custom lens. And I guess before we get into this new exciting procedure, tell us a little, you did the procedure for us a couple years ago.
Correct.
And it involved an actual blade to make the incisions, and now it's done with a laser.
That's exactly correct. Back when we, traditionally, and there's nothing wrong with traditional surgery, we're still offering it. I mean, that's the way your Medicare covers it, everything. We make a small incision in this cornea using a blade. Through that small incision, we go in and manually open the capsule to remove your cataract. And then we use a machine that breaks that cataract up into pieces for us to remove. That machine requires energy to do it. That's called phacoemulsification. And we remove that cataract with that energy. And then we put the lens inside your eye that we're replacing this one with, and a shield on your eye, and you go home. Okay, that's your typical traditional cataract surgery. Uses a blade and puts in a lens that will help you see distance. Pretty straightforward.
And then some people can elect to get a customized lens to help with reading and so on?
Correct. We have the ability now with some of our what we call premium lens technology to replace that lens with a lens that will correct astigmatism That's called a toric lens. Or they can help you see distance and near. That's called a multifocal lens. Now, not everybody is a candidate for all these lenses. It requires a great deal of assessment of your eye and ocular condition and visual needs. But there are options available now to customize your vision surgically that really have been evolving over the last several years.
And of course, if you get the specialized custom lenses, they're out-of-pocket expenditures versus...
Right. Your insurances will always cover your basic. But if you want additional premium services for your lifestyle needs or your lifestyle choices, your insurances generally do not cover that. But the important thing is that you, as the patient, understand you now have choices that you did not have before.
So that's the big plus of this procedure you're going to show us in a few minutes. We're going to be going in to see this. Tell us a little bit about what's involved with it before we head into the operating area.
Well, with laser-assisted refractive cataract surgery, we're coupling two things. The first thing is we're doing our cataract surgery. We're using this laser to do several steps of the surgery that were done manually previously. So we're getting rid of the blade part. Some people don't like the idea of blades. They like the idea of laser. We're also now, and what the laser is approved for, is the correction of astigmatism, meaning that we can alter this cornea to tweak or correct astigmatism you may have out there. Now,
What is astigmatism exactly?
Astigmatism means your eye shaped more like a football than a baseball. Okay? So no matter how you cut a baseball, it bends light equally in the same direction. If you have astigmatism or a football, you cut it one way, it will bend light differently than the other way. So it can give you distortion of your vision. To get your most pristine vision, you'd like to have like no or minimal astigmatism and that focal length coming on the retina. So we do a lot of testing and studies to say how much astigmatism needs to be corrected and how do we best focus the light back here to give you the perfect implant in here for your best distance vision. Now, the laser is what it will do here. It can do two things. It can correct certain amounts of astigmatism, which is approved for. Okay, that's what the laser itself is actually approved for. It also can be used to precisely line up that toric lens to correct astigmatism. So it'll make little marks there to help us line it up perfectly so that any lens we put in can help correct your astigmatism. But this laser also has the ability to create the incisions instead of using the blade, and we can put that incision anywhere we want to, exactly. It has the ability to go in and open that little bag to exactly a perfectly round opening of whatever size the surgeon would like so that we can remove that cataract. And then it actually goes in and it will soften up that cataract and cut it into little pieces so that when you go in with that phacoemulsification machine that I was talking about,
that sucks out the pieces?
Sucks out the pieces, it takes around 50% less energy. And that's really good because we're not putting that energy into the eye where it could, affect the cornea or the other ocular structures.
Well, I remember the previous procedure, those pieces were fairly big.
They're 4 big chunks.
Yeah. When this, I saw briefly what it looked like, very small pieces, so I imagine it is a lot more efficient.
A lot less energy.
And of course, very precise with a laser.
There is nothing as precise as a laser. Now, surgeons are well trained in cataract surgery. We do it all the time, and we're pretty good at it. But even as good as we are at it, there's nothing as precise as a laser. And I really believe that in about 5 years from now that this is going to be the standard. It's just amazing.
Well, it's great we have this available here on the shore.
It is. It is. It's exciting. I still find it exciting every day, and the outcomes are tremendous.
Well, how about we'll take a look?
I'd love that. The first thing that's really important about any surgical procedure, whatever it is to make sure you've taken the time to assure that it's the correct eye that we're doing and that your patient agrees, that you agree with your surgeon. The second thing when we're doing eye surgery here, because we're doing a new technology with femtolaser, we're going to be able to correct her astigmatism. In order to do that, I'm going to first have her in a sitting position where I'm going to exactly mark to line up that eye at its top and its bottom, what's called the 90-degree mark. The reason we're doing that is that's going to serve as a reference point for all the rest of our treatment plan. Probably the hardest part about this surgery is what we call the surgical planning. And there's a lot that goes into surgical planning, all kinds of tests in terms of the shape of the cornea. We'll take a look at that a little later. We have tests then that measure the amount of astigmatism that's there, and from there we decide which implant she is going to qualify for. Ms. Brown has chosen to have a restored multifocal lens that will allow her to see distance and near. Now, she has a little bit of astigmatism left. We will be able to correct that with this new technology femto laser to try and give her best possible vision for distance and near. In order to do that, we have measured the shape of her cornea at least 4 different ways. We've looked at it with her natural refraction. We've looked at it with what we call corneal topography, which measures the overall shape of the eye. We've looked at it with what we call manual keratometry measurements, and we've looked at it with what we call IOL master, which is optical biometry, looking at the shape. So by then we get all these numbers, and then we use our training and education to determine how exactly to best treat that amount of astigmatism, and that's what we're going to work on today. So this is a new technology, femto laser. Femto laser has been used for many years for refractive surgery, but using for cataract surgery is a fairly new application over the last few years. It's an incredibly efficient procedure which allows us to not only precisely place the incisions, to precisely create the capsulorhexis, correct her astigmatism, and also soften up the lens so we have less energy to remove the cataract. So we'll then ask Ms. Brown if she'll be kind enough to lay down for us, and we'll place her into a position with a very firm headrest that will keep her eyes still. We'll apply a numbing drop to each eye, such as this. Okay. And we'll get ready to do laser. The other very important part about this is hand washing. I've just come from a surgical scrub. Even though this is not a surgical procedure that involves entering the eye in sterile technique, we still do good hand washing technique. And if you'll notice that Russell, our laser engineer here, is also using gloves for this procedure. Okay, there are many different patterns we can use with this laser to soften the lens. The pattern that I am currently using, have chosen, is a new software program which causes a fragmentation pattern, and it's going to break this lens up into little cubes to allow for much easier removal. We will insert a lid speculum, and that is to hold Ms. Brown's eye open. Try and relax for me there, Ms. Brown. Easy for me to say, isn't it? You're doing great. Now, we're going to bring this down here after we moisten our cornea just a little bit, and that's again for comfort, and so we have a really good dock. Now, so what's going to happen? We're bringing, is that bed up please, all the way? Thank you. I think we're pretty good. Now, what I'm doing is I am aligning this, and I'm going to bring her head just a little bit because we want it aligned so we don't hit her nose. And I'll ask our engineer to please bring this to focus, which this laser is now automatically assessing the depth and the focus right there as we do it. We will now go on down into our docking procedure. Please look into the ring of lights there for me, Ms. Brown. That's perfect. You've got it. Stand by. Go. Now it's created a mild suction, and we're bringing that right up into a thing. Now you'll start looking at your screen pattern. Okay. The laser is now engaged. From now I'm going to adjust all our patterns that we have here. Okay. And as what I'm doing now is I'm adjusting for that little bit of twisting her eye has when she lays down. We're then going to go over and center what is called the white to white, and I'm making sure that this is all accurately centered, because to get the best possible centration for our multifocal lens. We're going to be bringing our incision sites out a little bit, so I make sure they're not anterior. So I'm positioning all these customizable for Ms. Brown's surgery here. I then come back and I want to make sure that this is exactly centered where I want my lens and my capsule to be. And that actually looks pretty daggone good. So I think I'm happy. Russell, are you happy?
I'm happy.
We're going to now scan. This is automatically taking a picture of her cornea. And is what I'll be doing now is assessing. We have what we call good dock. It's pretty flat, but we do have some folds here, okay? We've got to move this over to our high point, which we're going to move right over to here.
Yep.
Are you happy there?
Yep.
We're going to accept this. We're now going to be looking at our actual lens. You can see there's a very thick lens here. It's taking a picture of lens. We're at maximum already treatment. It's a very deep lens. So we're going to say we like what the laser is doing for us. We're going to look at now the cornea. This is where my corneal incision is, and bringing it back, and that actually looks pretty good, so I'm going to accept that as well. And we're going to now look at where we're doing our correction for the astigmatism. Let's take a look at this, and we can see up in here, I'm happy with that.
Yep.
Are you happy, Russell?
Yep,
now we
that's
do
good.
need a little more pressure on our eye, so let's just bring that up a little bit and do that. Okay, so now I have accepted, and I like everything, and I am happy with what we have, so I'm verifying accept. The laser will now be ready in just a minute. You're going to be watching this frag pattern going.
27 seconds, laser.
Ready. Here goes the laser. If you watch the center screen, that's making the opening to remove it. These are gas bubbles coming up. You'll see now it would look like a grid pattern in there. It's softening up our cataract, getting it ready for its actual removal when we go into the operating room itself. Now, it looks like a bunch of cubes. We're making our correction for the astigmatism over here, and in this area we're now looking at the creation of our primary incision, and then we're going to have our secondary incision over here. Now these bubbles you see are gas. We'll bring this up, relieve the pressure. Okay, awesome. Okay, at this point, Ms. Brown is going to be going into the operating room. Cataract surgery today typically is done in an outpatient surgery setting. The thing that's beautiful about our center here today, we have the new Centurion system, which is the brand new technology for what we call fluidics. The fluidics allow us to really control the bag that holds that cataract in such a precise fashion. It's pretty amazing. I say the difference in the technology with this machine and the previous machine is like the difference between driving a pickup truck and a Maserati. It's just as good as the other one is for transportation. This is just a different animal in terms of the way it handles and it acts and the way it helps us control this surgery. So again, we're going to hold her eyelid open with a lid speculum, and Ms. Brown is on the home stretch now. If I could please have the bed up just a little bit.
Nice deep breath in and out.
Thank you. All right, that's good. Thank you. Now, again, if you'll look into the screen, you can really see that grid pattern. That grid pattern is pretty impressive. And see how absolutely perfectly it's outlined there. So the first thing we do is open the incisions that the laser created for us. We have a little blunt instrument here. And the first thing, if you look at the light for me, Ms. Brown, I'm going to open is my little side port. Now, sometimes these can be tough to open, tough to see. Okay, so we're going to go just straight in here. And look at that. No cuts, just go straight in that little laser-created incision. That's pretty impressive. We're going to do the same thing for our side incision now. There she goes. Bingo. Okay. That having been said, now we're going to use, this is the part that's may sting this round. This is where we're numbing the eye. If you notice, we haven't used any needles other than her IV, but this just numbs it. That's a little teeny sting. That's all that she will really feel, because Peristylament, and this is keeping her nice and comfortable with a little happy juice. Okay, we're just putting what's called a viscoelastic. That viscoelastic is a thick substance that protects our cornea endothelium, and it also will keep that eye in a nice formed way. Now, if you look, you can see the nicely outlined capsule rhexis. Notice it is perfectly round. When we go to pull it off, you can see it's already unattached. I don't have have to do anything here, really. So just confirm how perfect it is. There it is. Now, we just took out that opening. Now that lens is opening, and what you're looking at there is a grid pattern that softened up that cataract for removal. Notice the golden color. The white fluffy stuff you see, and there's what we call cortical material. I'm now just taking a little bit of fluid, and what I'm going to do is just loosen that cataract from the bag that it's in very carefully. Okay, that's just making sure it's all nice and loose. And quite frankly, with the advent of the laser gases, a lot of time that's already the case. We don't have to worry too much about it. Yeah, you saw it just spin there, and you kind of see it coming out. So, we're getting ready to now physically remove the cataract. This is called phacoemulsification, which is a high-frequency ultrasound. By having the initial laser, Ms. Brown has set us in a situation where we need a lot less ultrasound energy to remove this. Okay, I'm going to take out that little bit. I'm just kind of scooping out, it's sort of like a little vacuum cleaner here. I'm taking a second instrument in the eye, and that second instrument is going to go in, and you can see my little waffle pattern. I'm going to go in. I'm cracking it up like an apple. See how that just cracked right open like an apple? We're going to spin that around. We're just going to go right in again. Crack it up like a little apple. Again. Now we've got a couple quarters. We'll do that one more time. Just spinning and turning it. We don't even have to hardly do any work because the laser does so much of the work for us now. I'll just get another good crack. Now I asked for quad, please. I'm asking our surgical scrubs assistant, please change the machine settings to what I like. I could do it with a foot switch actually, but a lot of times I get managed so they can see what's going on now. Notice that's coming out just like a big old quad of the quarter. I'm not using very much power here. I'm taking out those little sections of cubes. Those little sections of cubes have softened it up, broken it up. I've done, like I said, a good portion of this work for us. We'll spin this around so I can get to it. And so you can see like there, how there's those little pieces just keep sucking right out. Okay, there's nothing left of the cataract now. All we're going to be doing now is switching to what we call irrigation aspiration to take out the remaining little bit.
INA 1.
Okay? Now, let's stir this out. Ms. Carlene back here getting my second hand piece available. This is a different opening, a different setting on the machine, and in that white fluffy material is what we call the cortex. That's surrounding it. By the time I finish with this, you're not going to see it fluffy, it's just going to look like a big old red. Alright, so let me just finish. This part of the, when you have a laser, this part can sometimes be a little trickier, getting what we call the cortex out. But this is coming along just perfectly. Again, this is left is called the bag. And you can start seeing that opening coming quite clear in the bag. That bag right there. Okay, polish please. I'm changing my settings once again because I'm going to clean off my bag to get any little debris off of here because I want this as perfect as possible. We're now going to clean off that front part of the bag right in here. Okay, now we're going to go ahead and insert this Restore Multifocal Lens. Okay, and if you notice how clear this is with a perfectly round opening that's created by that laser. Now then, we're going to open this up, filling up that bag with another kind of, looks sort of like a goop, maybe. And that's, again, to protect the lens. This lens goes through a 2.4 millimeter incision with an injector. So when we go through here, we just absolutely just kind of, this injector is got to be, there we go. See how beautiful it is? It goes in like a little cigar. Look at that. Now they also have auto injectors we can use with this machine. They're pretty fun. They kind of just squirt it in there. It's not hooked up right now, but we can do that. Again, technology. Now if you look at this lens, the really fun thing about this multifocal lens is it looks like a frisbee with all kinds of different rings. I'm going to take out that thick goopy stuff after I open the arcuate, as Carly and Becky kind of have to remind me. Over here, we can see our arcuate. So we're going to open that right up into SOAR. That is the part that was created by the laser. Correction of first astigmatism. Just trying to make sure we got it all. See how the circles are in there, that multifocal. I'm going to take out that thick goopy stuff. Yeah, polish again.
Auto Sip Polish.
Clean this all here. Okay, this side again.
Up this way.
And I want to make sure all that other stuff is out of there so that that lens sits perfectly in there. That's what I'm cleaning out now. Okay, see that perfectly round, centered multifocal lens. Okay, now this is basically the home stretch of the procedure. Because what we're going to do is get the eye pressure back to where most of the throat. Look at the light for me, darling. There you go. Okay, perfect. Now we're going to hydrate the surface of this ring here. The top, we hydrate this incision from the laser a little differently than we do our typical incision. Now we're going to go into this other, make sure this lens is centered. I want that centered like that, perfectly round. Stay in the bag, we'll hydrate this one. There, I want to come back in, I want to do the other again. Okay, I'm correcting the pressure. When you see my finger there, I'm checking to make sure that eye pressure is where we'd like it, and I'm going to make sure that arcuate is all the way open, so I'm happy with it. I may not put as much as I would like there. I think it will right there. Okay, ladies and gentlemen, this is basically what we have now. Look straight at the light for me. If you look at that lens, it's perfectly centered in there. It's within the bag. It's a perfect cataract case. The next thing I want to do is make sure that that wound is nice and tight so that we don't run the risk of any infection. This is what we're doing right there, and your cataract procedure is done.
Well, we're back, and Catherine, how amazing that procedure is. Just the precision of it, the laser. I mean, just recap again the major advantages of doing this. And it's similar to using the machine that's with the LASIK procedures for vision correction, but you're taking it to a whole different level.
Femto laser technology has been around in the world of LASIK for quite a while. We've now learned how to apply it to the removal of cataracts, and it takes the ability for us to customize your surgery to a whole new level. I mean, we can basically tailor cataract surgery to meet your lifestyle needs and your desires. within the realms of what you're a candidate for, obviously. I think the thing that's different from a surgeon's point of view is now we're not just going in, removing your cataract and sticking a lens in. Literally, there is an extraordinary amount of planning that goes into your individual procedure to make sure that we're meeting your needs. Now, nobody will ever be able to promise you it's exact because we're dealing with human tissue and surgery. But we have the technology and the tools now to get pretty daggone close. And that to me is really exciting. And it's a new challenge for surgeons to think in a different way.
Well, that's how healthcare is. It's constantly changing with technologies and medications and all. It's very exciting.
Exactly. Constant change.
Now, how long does a procedure take? All in all, I know you said it's 2 parts essentially, and then tell us a little bit about the post-op instructions.
That's correct. It's a 2-stage procedure. So the first stage is you go into a procedure room where we do the femto laser treatment, and that whole process is a matter of minutes. It's just the time required to map out the cornea, and the actual laser treatment is maybe 30 seconds. So the planning is the big part there. Then we go into the operating room because we've done so much of the procedure already with the laser. The surgery itself is about 10 minutes now, and sometimes can even be faster. It's truly amazing.
That includes the cutting up of it, the removal of the pieces, and then putting in the new lens. Quick?
It's fast.
Wow.
It's fast. When you go home, when you finish your surgery and you go out, you're there for just not very long, maybe 10 or 15 minutes afterwards. Make sure your blood pressure's stable, that you're not having any problems, that you're feeling pretty good, have a little snack. Then we send you home with a shield over your eye to protect that eye, because that's now my eye, okay? Taking care of that. We have you start your antibiotics and anti-inflammatories and take it easy that day because you've had sedation. The next morning, you're generally seen in the office. We make sure everything is looking great. We ask you for that first week to be careful. Women don't wear makeup so you don't poke yourself. No heavy bending or lifting. You know, you can bend over, tie your shoes. You can pick up your books. Your little dog I'm okay with. But we don't want you to be in dirty environments, hot tubs, gardening, because you don't want infection. Basically, other than that, you go about your lifestyle, your activities of daily living. So it's
and eye drops for a week.
Eye drops 4 times a day for a week, and then another couple weeks with some anti-inflammatory a couple times a day. But it doesn't really disrupt your lifestyle, and it's not hard to do.
And you said there is some sedation, because that would be weird being awake for all this.
Well, we do use some sedation. It's mild sedation, and it helps you be a little relaxed. But honestly, most of the numbing is done with a little bit of lidocaine actually in the eye and eye drops. We don't use any needles in or around the eye anymore. The only needle you get for the procedure is enough to give you an IV so that we can give you that little sedation cocktail that makes you happy.
Right. Well, it's just really impressive procedure, and I know you're excited about it, and it's great that you're saying there's not many facilities in the state of Maryland that even have this technology, but it's great to have choices.
It is, and more facilities are. This is a growing technology. It's being adopted more and more widespread, and the thing to me that is exciting, as you say, is choice. And I think it's really important that individuals and patients, when they're deciding how they want to go, that they understand and learn what is current and what are their options, because choice in any field of medicine is only going to keep growing. So it's responsibility of a patient to be informed and ask questions.
Well, this is certainly helpful in that regard to show people what this is like compared to the blade procedure. And you say you still do those, a traditional blade procedure?
And I want to make clear, there is nothing wrong with a standard distance lens and a blade procedure. It is a very safe procedure with excellent outcomes. Okay? Absolutely, it is not that you're doing something wrong if you're getting that. Is what I want to make the distinction is you have a choice in how the surgery is done and what type of lens we put in your eye. Those are the 2 choices. You know, if you say, hey, I just want a distance lens, fine. Or I want to correct my astigmatism, or I want to see up near. That's your lens choice. How it's done, I want a blade, or I want the laser. That simple.
So there is hope for me to get rid of my reading glasses someday, should I need cataract procedure.
Well, again, that would be a conversation to have with your
Exactly.
ophthalmologist based on your visual needs.
Exactly. And do you see this being the standard of care someday down the,
I do.
down the line?
I do. To me, this reminds me of when phacoemulsification technology first came out.
What exactly is that?
Okay,
Remind
that
us.
was the machine we go in to use through a small incision to break things up, okay? And when that first came out, it wasn't widely adopted because the technology was a little rough and it was tough on the cornea. And it took a while for that to become widespread, but now that is the standard of care basically in the world, okay? And this reminds me of that. You know, as the physicians are adopting and becoming comfortable with the technology and learning what it can do for us, I think at some point it will become the standard. I mean, in ophthalmology, we've been using lasers forever. We have many types of lasers we use, and this is just another use for laser technology that we've been dealing with for many years.
And I assume there's some standardized training you have to
Oh yes,
go through
oh yes.
to be certified to use this.
You do. It's very, very rigid. Actually, you are required to watch, video coursework, and then once you do that, it is required that you work with personalized trainers, basically, to do this. And then, from our point of view, it did site visits, seeing other surgeons who were doing it and asking the right questions. So there's a lot of preparation that goes into rolling out this type of technology. And I'm pleased to say now we've been offering this technology since for almost a year. I guess it's been 3/4 of a year now. And I can say our outcomes have been great. There have been no surprises that I've been disappointed with. And I just think between the femto laser technology and what we call some of the new changes in our phacoemulsification machines, it's taken cataract surgery and its safety profile and its outcomes to a whole new level. It's a quantum leap in what's available.
Well, thank you so much for coming on the program and taking us into your operative suite, and of course to the patient for consenting to let us film her. And we really appreciate it. I'm sure our viewers will get a lot out of it, and I appreciate you taking the time and
Thank you for having me. It's always fun to be with you and your team, and we hope we bring some valuable information to your viewing audience.
Well, thanks again. And thank you for joining us for this edition of Focus on Health here on PAC 14.